Hey mamas, and welcome to the Entering Motherhood podcast. I'm your host, Sarah Marie Bilger, a wife, mom of two, VBAC mama, and doula. Here we integrate holistic mindfulness and evidence-based practices to support you on your unique motherhood journey. Whether you're trying to conceive, pregnant, newly postpartum, or supporting mamas in this stage of life, you'll feel empowered and informed as you embrace what lies ahead. Join us every episode to learn from professionals, special guests, and moms just like you, ensuring that you know what you need to know and discover things that you didn't know before. I believe in you. Let's doula this and let's navigate the transition of entering motherhood together. Hey mamas, how are you? I'm super excited to get this episode started and talk to you today about GBS because this is a conversation and a topic that comes up a lot with my clients later in pregnancy when we get closer to the testing. And I really just want to inform you on what it is and what it means if you test positive or negative and how it can impact your pregnancy, your birth, future pregnancies, and everything like that. So basically, we're just going to start off with what is GBS. And, if you're listening to this, maybe you are preparing for the GBS test or you just tested positive and you really want to know what is going on, what do I need to know, and how can I really approach this going into my pregnancy further. And so GBS is Group B strep. It's really important to talk about because it can affect, like I said, the labor, how you labor, what kind of things are going to be happening, different protocol. But it's not something that I want to approach in a scary way or try to stay neutral about this, but also bring in a little bit of my personal insight and background as a doula, as a mom myself, and just somebody who is informed about this. So I actually tested positive for both of my children. I guess technically could have declined the test, but I did decide to get tested. Here in the United States, it is universal testing, so that means that everybody gets tested no matter your risk level and such. In other places, in other countries, sometimes they have risk-based testing. So typically that means the difference between universal testing and risk-based testing are if it's universal testing, everybody at a certain duration in their pregnancy will get tested no matter risk level or not. In other places, such as the UK and Germany, they do more of the risk-based approach. And so, like I said, here in the United States, also in Canada and Australia and France, I believe, they all will partake in the universal screening. And so typically it kind of depends on your OB or your midwife, whoever your provider is, at when that testing is happening. But most likely you are going to get screened for GBS between 35 and 37 weeks pregnant. The risk-based approach is going to be looking at, like, maybe if you tested positive before, after baby was born, or if you did, for whatever reason, test during your pregnancy before, and this time it's not necessarily required, but because you did test positive, they are asking that you do it again. And so, like I said, no matter how you're being tested or if you're being tested or if you choose to have testing done, it is typically occurring between that 35 and 37 weeks of gestation. And so with that, let's kind of talk about what the test is and a little bit more what GBS is. So GBS is a type of bacterial infection that can be found in the digestive tract, the urinary tract, and all of the genitalia area. So how this is being done is with a swab, and it's usually almost like a large Q-tip that is just swiped from the vagina and rectum, and then it is just sent to a lab for testing, and they let you know if you are positive for the bacterial infection or negative. It's actually really quite common, and 1 in 4 pregnant women will carry GBS. Like I said, I was GBS positive for both of my pregnancies, and it is something that can literally, you get tested at 35 weeks and you're positive, and maybe you get tested at 37 weeks and you're negative. It's something that kind of like flows in and out, but usually once you test positive once, you are kind of just known to be on the path of being a positive GBS patient. And GBS can cause serious infections in the newborns. While you might not know that you have it or even can tell that you have it, it more so affects the newborn when it is passing through the vaginal canal and contracts the GBS. So this can really lead to pneumonia, sepsis, meningitis, and can really be life-threatening for the newborn. So that is why some practices, some providers, some countries will do the universal testing, because they rather know and be aware that the mother is carrying GBS than to wait until the baby contracts it through birth. So the testing helps in identifying mothers that do carry GBS. And right now, the protocol for if you are testing positive is administering antibiotics during labor to potentially offset and prevent this transmission to the baby while it is being born. And so that would be when you test positive for GBS. So when you test positive, it means that you are carrying the bacteria, but it doesn't necessarily mean that you will have an infection or even pass it to your baby. It just means that you currently are carrying the bacteria in your body. And like I said, this is going to be then determined that, or brought to your attention, that antibiotics are going to be needed during labor. Here, they recommend at least 4 hours before birth that the antibiotics be administered. And so this is a little confusing because we don't know when the birth is actually going to happen. We can have a little bit of a rough estimate and maybe know when you're in active labor or early labor and such like that, but we don't really know when baby is going to come. So when it's 4 hours until baby is born, it's a little vague on what that means and when the antibiotics need to be administered. But it typically doesn't change anything else about the delivery plan. It just could potentially mean needing to go to the hospital early to ensure that you receive the antibiotics in time. And even with this current protocol that we have of administering the antibiotics, it's not an end-all be-all. This is a perfect solution. It's just what has been found to be the best treatment during labor to reduce the risk factors. So again, this is something that you can really talk to your provider with, even with getting tested and understanding the results and figuring out how this is affecting your birth plan, your delivery plan moving forward, and what your preferences are and everything along those lines. Obviously, if you're having a scheduled cesarean, then getting tested for GBS and really the risk of baby contracting GBS is almost non-existent, because if they're not passing through the vaginal canal, then they are not contracting the GBS. But if you are laboring for any extended period of time, if your waters have broken, if there has been any sort of contact with baby and the vaginal canal, then there is that possibility of GBS being transmitted. And with that, then also negative GBS test results. If you test negative, then this means that you're not currently carrying the GBS bacteria, and no special precautions are then going to be required or suggested during labor. Sometimes they might do, like I said, another test or testing a few weeks later, just because of that possibility that you might not have it 1 week and then you could have it another week. So that's typically not going to be done unless there's specific circumstances or other symptoms of having the infection, or if it's just something that is kind of being suggested because of other risk factors. But usually if you test negative once, you are not required to have any additional testing for GBS after that point. GBS is not going to be treated typically before labor, but there are some things that you can be doing before you test for GBS to help reduce and lower your chances of testing positive before the testing. That might be taking probiotics, incorporating probiotics more into your diet, like yogurt, cottage cheese, sauerkraut, miso, things like that. Different types of food that have really high concentrations of probiotics. So this, kombucha, kimchi, also like fermented foods are all going to be great resources for incorporating more probiotics into your diet, which has been seen and shown to lower the possibility of having GBS. But again, this is all something that if you want to discuss with your doula or your provider or other people that might have different outcomes. I personally tried to do all of the things to not test positive again for my second birth, but it just turned out that I tested positive again despite taking different vitamins and food sources and things like that. So really, it's just kind of one of those things that might be inevitable, but it's not really deterring your birth preferences in a huge, impactful way. Sometimes other different considerations, if you have tested positive for GBS, that you might want to be aware of and contact your healthcare provider is if your water breaks, because again, this is something that is disturbing the separation between baby and your vaginal canal. If your water has broken, then this is obviously opening up baby to the GBS more. And so they might suggest going to the hospital and starting the antibiotic treatment then. But I will say from personal experience, that's sort of what happened and occurred with my daughter with my first birth, and what ultimately going to the hospital too soon and a bunch of different interventions and just not feeling ready led to a cesarean. But that's not obviously always going to occur and always the case, and it could be great and wonderful if you go to the hospital when your water breaks. But just to be aware of, if you have no other signs of labor and it is only your water breaking, maybe just have a talk with your provider and see what they feel and you feel comfortable with and what you ultimately feel is the best case scenario moving forward. So just keeping that in mind, but that might be the situation and the protocol when your water does break, but ultimately knowing that it is your decision and being informed about all those decisions and different possible outcomes is what can really make the difference in your birth. And so with that, I also want to point out risks that are associated with taking the antibiotic. So while some people might feel like this is best case scenario, take the antibiotics and everything's going to work out and be fine. There are always, risks and benefits with everything associated with labor and birth. And so with antibiotics, they are generally safe, but there could be some side effects, including allergic reactions. So if you don't know that you have an allergy to antibiotics yet or anything, it could be something to discuss and be a concern with your healthcare provider. But also, like I said, taking all of the probiotics and prebiotics and things like that, you want to definitely make sure when you are taking antibiotics, because it is really trying to get rid of any sort of infection that's going on. It is also simultaneously killing off good bacteria while killing off the bad bacteria. So making sure that you are replenishing your gut microbiome and incorporating probiotics afterwards is going to be super beneficial, especially if you've had multiple rounds of antibiotics. I also feel like this is something that led to us having thrush with our first birth. So I was on antibiotics from the time that I got to the hospital until my baby was born via a cesarean. And so they were administering the antibiotics every 4 hours over a 24-hour period. So I probably had at least 6 rounds of antibiotics for my first birth, which really kind of wrecked and ruined my good bacteria. And so my daughter developed thrush, which is an infection that you can get in your tongue and gums and throat and everything like that, which also developed an infection on my nipples, which was very painful. And since I was a first-time parent, I was very unaware of the sensation and feelings and what's normal and typical with breastfeeding. So I had thought that this was just a normal part of getting used to nursing and adjusting to the sensations of breastfeeding, but it was very painful and also causing issues with my daughter latching, and she was uncomfortable while nursing. So once we had determined that that's what had happened, we had it all worked out. But again, this is another risk that can occur from taking so many rounds of antibiotics. So just kind of be aware of that and really kind of understand those risks and benefits of taking the antibiotics and what that means. And so really just kind of determining what you feel is the right decision for you moving forward, understanding that you can decline any testing, you can decline any medication, and that you are ultimately in control of your birthing experience. So with that being said, there is no way to completely prevent carrying GBS or passing it along. It's not anything that has to do with having proper hygiene or, making sure that you have regular prenatal care or anything that you have personally done. It is just one of those things that can sometimes occur and is existing in your body, in your system, but it doesn't have anything to do with something that you had contracted or improperly cared for your body. So I just want to also point that out and let you know. Again, with the antibiotics, there are different antibiotics that are used during the treatment. So here in the United States, they typically use penicillin. That will be like their first choice. There are sometimes different alternatives available if you're allergic to penicillin. So again, like talking and discussing with your provider and seeing what kind of antibiotics are available and administered. That is the same, I believe, in the United Kingdom and Canada, even Australia and Germany, France, all the other countries are typically using penicillin first for a choice of antibiotics. That also, if you're wondering, is administered via IV. So there are multiple ways that if you do get tested positive for GBS and you are deciding to have the antibiotics, there are different ways that it can be administered. Sometimes it can be mixed with a saline solution, so it doesn't have as much of a burn, but it is a slower release and a slower protocol of how it's being administered. If you get it straight, then it's a shorter amount of time, which means then you can not be attached to the IV for as long of a time, but just be aware that sometimes there are more reactions that are occurring in that way and more noticeable feelings and sensations when it's being administered that way. Again, it's just something to discuss and be aware of so that you know what all of your options are going into it and that you can choose which method you want to have and how you want it to be administered. So again, with being hooked up to an IV, depending on how long it takes, whether it be, 5 minutes or 20 minutes, whatever that might be, you are connected and attached to an IV. And so that limits your mobility and the way that you are able to navigate in a hospital setting. This is also something that maybe if you were planning to have a home birth or a birth center birth, that they are not able to administer the antibiotics. So that is, again, something that you have to be aware of and talk about and discuss if those are possibilities of how you plan to birth. But overall, that is kind of the protocol and the procedure for GBS testing, what happens if you test positive versus testing negative, how that affects your birthing preferences, what that means going forward in labor, and how that can really adjust things in your plan and in your pregnancy. So, and in the outcome of your baby's birth. So I hope this was super informative. I hope it really kind of gave you a general overview of GBS and where you're kind of situated now if you just found out that you're positive, or if you're about to take your GBS test, you're going into it being a little bit more informed and aware and knowing some things. Hopefully you learned some new things. If you ever have any questions, feel free to reach out to me. I'm very active on Instagram at Entering Motherhood. Or you can always reach out on the website and find me that way and email us. So thank you so much for listening. If there's ever any other information that you are aware of that I didn't mention, please reach out to me so that we can always add to the next episodes and really kind of answer your questions about GBS or about any other topics that you want to see. I'm super excited for what's to come with Entering Motherhood. We are in the process of making a childbirth education course that is going to incorporate so much of this and other topics and what you really just need to know that you don't know. I think a lot of the times with my clients, they're just curious about what's to come and what's going to happen. And it's this mindset of, I just want to know what I don't know, and I want to be fully informed and aware of my choices and all the different possibilities. And so that's really what we're trying to do. That's really what we hope and plan to do so that you can be making informed decisions and that you can be fully aware and in charge of your birth and your pregnancy and everything as you are entering motherhood. So thank you so much for listening, and I'll see you later, mamas. Thank you, mamas, so much for listening. Remember, you are a rock star. I believe in you. Let's doula this. Let's crank it up a notch and let's kick it into high gear together. Hit that subscribe button, share this episode with a friend, message me, email me, call me, beat me. You know how to reach me. We're doing this, mamas. I am so excited to catch you here next week. This is your one-stop go-to place for helping you find the resources you need to make the best choices for you and your family during pregnancy, birth, and most importantly, postpartum. See you later, mamas.